HIV-associated stigma is particularly prevalent in the prison setting and often affects the need for increased confidentiality as well as participation in care. It often also leads to feelings of social isolation. Providers in the correctional setting often are unaware of how stigma is influencing their patients' behavior and engagement in care, and awareness of stigma and attempting to minimize it to the extent possible can lead to better medication adherence as well as willingness to participate in care. Stigma is defined as a mark of disgrace. And HIV-related stigma can manifest in many ways within the correctional setting, from both other offenders as well as from staff.
I can't talk to people that aren't positive yet because I don't know how to not care what they think. I'm still really stuck on the fact that they might think I'm less of a man because I'm HIV positive.
When I was in jail, I was segregated, put in a hole, and all my meals were delivered to me. And of course, this was in '95, but they were delivered to me by 2 officers in hazmat suits. Some officers refused to pat search me because they know I got HIV/AIDS.
I've been called, quite a few things with the words infested. AIDS infested, whatever. Many choice words. People that didn't want to sit at the same table with me.
In prison, it's more closed-minded even than our community. I was shocked when I learned that. I thought they would have been a little more open-minded in prison, but it's not the case.
If you get put into a cell with a guy who's got some kind of prejudice, you're going to have to defend yourself. It's the nature of the environment that we live in.
That fear of rejection is huge. You're already here alone doing time, and then to have people treat you that way because it's something that you were diagnosed with, that you have to live with, it's really hard.
Confidentiality is extremely important within the correctional setting, but at the same time can be very difficult. However, every attempt should be made to keep medical information confidential. This includes when, where, and how offenders are seen, where labs are drawn, how medication is administered, and how and to whom information is communicated.
I'm able to come to a call out and know who's on the same call out the same day to see the same doctor for similar circumstances. Any measure of intelligence allows you to categorize people like that, and that's a kind of a breach of their confidentiality.
When I'd go to the pill line to get my medications, there would be a picture of me in their little Rolodex where they saw the inmate that was being served the medications. And on my card it said universal precautions. So every person that had my card in their hand knew, because nobody else's card had universal precautions written on it. So that made me feel really uncomfortable.
Celly sees the medicine, he's like, what is that? AZT used to come with a little unicorn on it. Everybody in prison knew, look for the unicorn pill. If that was your celly, get him out of your cell. And that was one of the things that caused a lot of people to just not want to take the medicine.
How care is delivered in the correctional setting directly impacts how well patients will engage in care, both during incarceration as well as after release. It is extremely important to engender trust by being non-judgmental, avoiding blame, and listening to your patient.
There's little or no trust involved in my daily life, and when I am trying to get better in any way, shape, or form, I need to be able to know that I'm being heard.
Sometimes you don't see the doctor for 3 months, and then you have to kite, the PA that's helping with your case, And then you have to come in and hopefully you're able to bring up those feelings that you had so when it happens again, you can address it.
I can't say how many times I've felt, whoa, something is really going wrong, and I try to share it with a PA or a doctor or somebody, and it's dismissed out of hand.
It's not just about the physical part of it or the blood levels. It's a very mental, emotional thing to deal with. And I think it's important to know that your provider isn't just there for those issues of your blood work and different things like that, but to support you emotionally and mentally, to make sure that you're where you should be.
A few moments of taking the time to educate a guy about what's going on with his body when he asks the question or presents a problem goes a long way towards trust.
Incarcerated patients often feel very socially isolated. It can be extremely helpful, despite logistical challenges, to create correctional programs that allow HIV-infected patients to talk about their HIV diagnosis and express their feelings and experiences while maintaining confidentiality.
So since I've been in prison, I've had no friendly support.
You know, volunteer like pen pal things to, you know, people that might be struggling too, that might be able to, somebody you can share your struggles with.
First of all, there's two groups that you have to educate. You have to educate the people who are HIV positive, and then you have to educate the people who aren't HIV positive. Whatever the percent of individuals we have with HIV in Washington State prisons, it seems to me like a really good idea to allow them to have a means of communicating with one another in a confidential forum.
I'm really excited to be released from here. I got 2 years left today, and I can't wait to get involved in the community. I want to go speak to youth about this. I want to be there for women who are just finding out they're just being diagnosed. Those are the women I want to be there for, because it's just so hard to get through that first part, and I want them to know that somebody's there and that they're not alone.